You're listening to the MotherToBaby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the MotherToBaby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I give information to patients, family members, healthcare providers, and the general public about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a medication that you take. It could be a chemical that you work with. It could be a vaccine. Lots of different things can be exposures. Today's episode is the last of a 3-part series about fetal alcohol spectrum disorders, otherwise known as FASD. In the first 2 episodes, episodes 81 and 82, we learned about common features of those diagnosed with FASD, how FASD was first discovered, today's research about it, and what's being done to address the stigmas around FASD. By the end of this episode, we hope you'll be able to better understand what it's like for families affected by FASD in one way or another, and be able to answer the following question: how can we improve transitioning from pediatric care to care for older individuals with FASDs? I am very excited to introduce our 2 guests. Jenn Wisdahl is the Chief Operating Officer at a nonprofit called FASD United. She leads the organization's legislative and policy agenda and trains members of the FASD community to serve as advocates. Jenn was also an executive producer on the award-winning short film, The FASD Project, and is a proud parent to 3 young adults with FASD. I'm also excited to welcome Laura Bousquet, a passionate FASD advocate driven by her personal and family experiences. As a mother to a young adult son diagnosed with FASD in his teens, she witnessed systemic challenges across many areas of care, including education, healthcare, family court, and the judicial system. An active board member of Texas FASD Network and an FASD United Family Navigator, Laura's own FASD diagnosis inspires positive change in the FASD community. Jenn and Laura, thank you so much for joining us on the podcast today. So we're going to dive into a little more about each of your involvement with advocacy. But to start off, Jenn, can you tell us a little bit about FASD United?
Sure. So FASD United is the national organization that supports people with FASD, as well as promotes healthy pregnancies free of substances known to harm pregnancies. So we exist to uplift this issue and really give information and support to the general community, as well as spark a fire in people about how they can help and how they can help promote healthy pregnancies and help recognize people with FASD in their own communities and support their needs. We've been around for about 35 years, 35 years this next year. Formerly the National Organization on Fetal Alcohol Syndrome, NOFAS, and we're a growing team that spreads all around the country. We have 47 affiliates throughout the U.S. Who deepen the work on a state level, and we're growing, and that's exciting.
So, Laura and Jenn, for each of you, how did you become involved with adoption, and more specifically, adoption of children with FASDs? Laura, would you mind starting us off?
Sure, thank you so much. Yes, so I will tell you that I am an only child, and as an only child, with most of my family being overseas in UK, that sort of thing, I had always dreamed of an adopted sibling, so much so that I looked them up back in the old school days in a phone book and called agencies and said, hey, my parents are looking for information about adoption. So I was quite resourceful even at that age, right, and had the thought process. But you know, as an adult, when the chance came along in my life, I looked at both international and state options, and eventually went through Catholic Charities from my parish. Just seemed the easiest step. I met my son when he was 2. His adoption was finalized by the time he was 5. Early on, he had only been diagnosed with oppositional defiant disorder based on an assessment done in the child welfare system at age 2. And to be honest with you, as a parent, I really just kind of looked that over because I thought, what 2-year-old doesn't have an ODD, right, at age 2? And so, so I'd gone through a year-long training with Catholic Charities about really what to expect about the child's needs, that sort of thing, but there just wasn't much about prenatal alcohol exposure. So most of the focus was on other potential stratagems and their impact, but not necessarily. So I didn't necessarily go in with my eyes wide open.
Got that. Jenn?
Well, I went in with my eyes wide shut. Contrasting Laura a little bit. Unlike Laura, I have lots of siblings and had always wanted to have a large family. And so when my husband and I were faced with infertility, we began looking at adoption as a way to grow our family. And we went through a number of rounds of in vitro prior to that, unsuccessfully. And we went to we attended a session with the state foster care agency where we were living at the time. And they talked about how if we were going to adopt from the foster care system, we would likely be adopting a child with prenatal substance exposure, likely FASD. So this is very, not common. That doesn't happen in the foster care world, but it worried us so much that we might be raising a child with an FASD that we ran straight to the nearest private adoption agency and ended up adopting through them. What we didn't know is that the little boy that we ended up adopting, we were his 5th parent in 5 years because he had been in and out of the foster care system. And we ended up finding out at age 10 that he actually did have FASD. So everything that we were worried about as first-time parents, we got. And after that, after the stigma of, oh gosh, this little guy is so lovable and has so many great strengths to go along with some of these big challenging behaviors, it didn't matter anymore if kiddos had FASD or not, and we ended up specifically adopting 2 additional children who were prenatally exposed and subsequently have FASD diagnoses.
What a journey. Up until that point, and years had passed more. I'm so interested to hear more about your family. But first, Laura, how and when did you become diagnosed with FASD?
Sure. So I was diagnosed just last year at the age of 57. So last summer, I was in Louisiana at an FASD summit there, and during some pretty research-heavy presentations, taking some breaks in between those presentations and doing something called a brain dump because my mind was so full of all the information that had been given me. So I just pulled out, the notes section on my phone, and I just started writing down all these different diagnoses, all these different challenges and events that had happened in my life. And I looked at it, and it was like almost a gut punch because it certainly looked like an FASD profile. But it was my profile, so it couldn't be. There's no way, right? So what shall I do with that? Shall I delete it? Shall I hide it? Pretend like I didn't create this list? But eventually, later that evening, I was out to dinner with colleagues. I took that note that was on my phone. I put it in the middle of the table with some of my colleagues that are very much FASD trained, and they thought it was my son's list. And I said, no, in fact, it is mine. And, they joked about, well, welcome to FASD through yet another lens, right? And so I followed that up. They encouraged me to pursue a diagnosis if that's something that I felt comfortable with doing. So I reached out to SDRC in Arkansas, where Dr. Cleveland spoke with her on the phone. She provided me the paperwork. But with that being said, I sat on the paperwork for 2 or 3 months. Although I filled out the same paperwork for my son many times, when it was for me, all of a sudden I had a barrier, and I didn't know how to do that. So anyway, finally completed that, and then had the actual evaluation. With that being said, I was very much prepared with that. I thought, I'm going to pass this evaluation. That's what I'm going to do. I've tried so hard all my life. So I had paper, pen, even a calculator, and I'm sharing with Dr. Cleveland. She probably had 15 to 20 individuals on the assessment, because not often do they get to do assessments on adults. Mm-hmm. So I have agreed to that. And so I told her how I am prepared. And she said, I'm sorry, but you cannot use any of that. You cannot use any paper, pen. You cannot take notes. You've got to use your mind. And at that point, I wanted just to close my laptop down. I wanted to run out the room because I felt as if she had cut my legs out from underneath me, and I was most definitely going to fail. So what is the purpose of me continuing, right? But she was able to talk me through that, and I saw the significance of exactly what I needed to do. But with that being said, I did have all these researchers and clinicians and all of that looking at me, getting all that data, getting all that evidence that they needed so they could do it. But I had one individual that was there who was an FASD self-advocate. And she asked me humanistic questions. She asked me questions that made me feel heard versus just that data collecting. So it made all the difference in the world. So that was the process of that. And again, that was just a year ago. Yes.
How are you doing now?
Well, thank you for asking. Yeah. So a year ago, people would often ask, how can we support you? Oh my goodness, you have this. How can we support you? That sort of thing. And just that question in itself was overwhelming to me, because I spent so much of my life proving I didn't need support, proving that I didn't need help. I had masked so much of my life. So it was wonderful to have support, but at the same time, I didn't know what to ask. And so now, a year post-diagnosis, what does that look like? And I'll give you an example. So for speaking engagements, I need to have the questions ahead of time. I need to be able to take time to process the questions, and maybe even reach out to the moderator, the podcaster, and I want to make sure I understand this question correctly so I can answer it correctly and authentically. I will share with the moderator or whoever it is that here are my answers. If I feel as if I get stuck, or if I'm going down this other trail, please feel free to prompt me. Those sort of things. So, if I'm having a meeting with someone, I ask them in the last 5 minutes of the meeting, can they go over with me the notes that I took, or maybe follow up with an email about the important things we talked about. So I'm learning what those accommodations and supports are, so that I can be successful going forward, and learning that I don't have to mask. Finding those safe places where it's okay and I don't have to mask, because it takes so much energy.
That is amazing that you have found a community where you can feel more often you can be your authentic self. I'm very, very glad to hear that, and so glad that you were able to bring that up and share that with us. Thank you. Let's focus on your dual lens. As you said, actually, I'm sure you see it through many, many different facets. But as a self-advocate and also a caregiver, can you describe your experience living with FASD?
Sure, yes. And yes, you're exactly right. That is a huge question. So whether it's a self-advocate or caregiver, it's complex, it's confusing, it can be overwhelming, but I'm definitely grateful for my diagnosis. It brought me clarity. And then not to mention that I really understand that journey that my son is on. So some of the accommodations that he needed, that sort of thing, all of a sudden it made sense to me. So again, with that being said, he's 6 feet tall, weighing around 200 pounds. He looks like this young college kid, right? But he still requires 24/7 supervision. He's still not able to cross the street safely. Can he do a lot of self-advocacy work? Yes. Can he do a lot of other skills? And does he have a lot of strength? Yes. But that dismaturity that people are not understanding, that yes, chronologically, we've got a 21-year-old, but in some areas, he may be a 9 to 12-year-old. What does that look like for him, for his therapist? His therapist tells me that he has to prep all week for that 45 minutes with my son, because he said, it may be a 9 to 12-year-old that we're working with activity play or play therapy, right? But he says every now and then he'll pop out with that 21-year-old autonomy and questions. And he said, I've got to switch that. Yeah. I said, imagine what that's like 24/7 as his caregiver, right? So it's about patience. It's about flexibility and understanding that every day is going to be different. I think that FASD is consistently inconsistent, right? Setting realistic goals is key, not just for him, but for myself, right? Managing those expectations.
Yes.
Celebrating the small victories. We talked about this earlier, the importance of having a network of supporters and caregivers and what that can look like. On the self-advocacy side, again, it's been empowering for me to have that. People often ask, my child, my adult has all these other diagnoses. What's the point of just adding more? Well, it's absolutely worth it. Absolutely. So on a deeper level, it's helped me understand myself physically, emotionally, mentally, and I can reflect back on the choices and struggles that I've had and understand that it's okay to ask for help now, right? And focusing on that self-awareness and, the accommodations that we talked about. So whether we're talking as caregiver or as a self-advocate, that resilience, the patience, and the constant growth, knowing it's a lifelong journey, and it's a marathon, not a sprint.
Yes. In this very instant gratification world that we live in, it's so important to remember, and to give grace, give yourself grace, give yourself that love, give the people around you that love, because it's not a sprint and it's not over quickly. It is the long haul. And thank you for remembering that. And Laura, also thank you for reminding us all that we are entitled to take up space in this world. So like when you mentioned the masking again, which was so profound, I'm so glad that you have found this community, and I hope more people will. But you do deserve space, and you deserve to take up space in your authentic self. So again, thank you for reminding us of that.
Thank you. Thank you.
My pleasure. Children with FASD grow up to be teens, young adults, and adults with FASD, right? So can you tell us about your experience with that transition? And more to the point, how can we improve transitioning from pediatric care to care for older individuals with FASD? And Jenn, I'm going to toss this one to you first.
I feel like this is my daily life right now. I have a 15-year-old, an 18-year-old, and a 22-year-old.
It is your daily life.
It really is. We eat, breathe, and sleep this as a family. And I think, one of the important things to remember with persons with FASD, while they may process things at a younger age, they still have the same wants, needs, and desires that any person their age might have. And it's like Laura was saying before, that switch between and being flexible between the expectations of what you would expect of somebody at 18 versus the wants that somebody would have at the age of 18. Right. Those can be very different. And if you've met one person with FASD, you've literally met one person with FASD, and that it varies by person. So, but I think some of the things that have really helped our family on our journey and helped us to be just in a really good place with our kids is that we do give them as much self-determination as they feel they're capable of. We want them to be able to make their decisions around medical issues. That takes a lot of prep, though, and that takes cooperation and coordination with the providers, because often you would not expect mom to come to your medical appointment when you're 22, right? And there's a lot of information that's given out at a medical appointment. There's a lot of information that is given to the patient and a lot of information that the patient's expected to give to the physician. And one of the challenges with FASD is that there can be issues with memory and working memory. And that masking that Laura talked about, the need to people please, sometimes there'll be some fill in the blanks with maybe not factual information because they want so badly to be seen as mature and adult. And so medical providers can really help by, if they want to have a parent with them or a friend with them, allow them to have that need or that support from a trusted adult, because all of that information you get at the appointment, like for us, we'll come home and we'll read through any information that's printed out. We always ask for a printout. We will look up terms that aren't understood. We'll break it into small chunks. We'll have that information available and give the support to process it. Because, a 20-minute medical appointment, you get a lot of information thrown at you.
Yeah.
And so it just because a person with an FASD is an adult, we can't expect them to process things the same way as a person of the same chronological age, but we can still treat them as a person with that chronological age. And it's the balancing act, right? One of my kids' pet peeves is when we'll go to a physician and the physician will talk to me as opposed to them. That's, and I even, my youngest is great for this. She'll say, I'm the patient. I would appreciate if you'd talk to me. My mom will help when she's ready.
Nice. Some self-advocacy.
Self-advocacy.
Yeah.
Exactly. And it can come across as a little sassy sometimes, but, I'll go with that, because self-advocacy sometimes means that you got to put yourself out there and set a boundary. And so I think physicians can help with that. Clinicians can help with that, definitely, by just understanding that the ability to take in information may be different than the desires that are normal with that age.
Laura.
Yes, 100%, Jen. Yes. So I'm just going to share real quickly. My son just, went in, it's probably about a year ago. He was transferring from his private pay, PCP, to his child Medicaid PCP. So with that being said, he went in, again, want to give him the autonomy, want to give him the opportunity for self-advocacy, that sort of thing. And he went in and said, yes, my name's Sean Patrick. Before we get started, I would like to see if you're familiar with FASD. If not, I would like to chat with you about it before we get started. The response that he received at that time was, no, I'm not familiar with it, but if I am, I will go look up in a medical journal. My son just shut down at that time. Mm-hmm. And so, but with that being said, I've taught him and myself, we wait 24 hours before we respond to a negative situation. What we ended up doing is within 24 hours sharing information with her that was specific for professionals, through an about FASD. She called me in 48 hours and said, thank you so much for this information. You and your son are the professionals, and I apologize. And so, fantastic, nice. Right? But I wish we hadn't have gone through that.
Yes.
So again, just like you had mentioned, Chris, and Jen, you had mentioned this transition, right, to 17, 18, 21, and societal demands and expectations and navigating what's supposed to happen next at those ages. Whether we're talking social services, waiver programs, Social Security, finding support, executive function, social skills, all that can be overwhelming, not only for the individual impacted with an FASD, but for that family trying to help them navigate it, right? So ideally, let's pull out this magic fairy dust. What would that look like? To me, that would look like having a guide, someone to support the family, help navigate this very complex transition, a professional who understands FASD from a neurobehavioral, brain-based perspective. They could help caregivers understand what's going to happen at age 18 in terms of legal responsibility, or age 21 for social services, that sort of thing. So I think that would be incredible. It could be tailored to the needs of an individual with FASD. So, social skills groups that emphasize executive functioning and adaptive skills. We just talked about that earlier, with my son, that yes, he can do a lot of things, but just simply crossing the street at age 21 is still an issue. So, things that are framed with an FASD specific approach. And I will share that most executive functioning and social skills programs are not through the FASD lens, and that makes all the difference in the world. A transition guide, if they existed, connect the families with different waiver programs, Social Security resources, all of that, and creating a continuity of care from that pediatrician to that adult PCP would be fantastic, and not having to re-explain everything, making sure that it is structured, it is individualized, and we focus on those strengths of those individuals. And so I think with all of that being said, that would help them create a foundation for more successful adulthood, right? Because it's so complicated. You talk, yeah, absolutely. We go in, so Sean goes with me to all my appointments where appropriate. I go with him to all his, and we use each other. Like, I want you to take notes about what they're saying about me, and you take notes. And then, again, like Jen had mentioned, we also ask for everything to be in writing, because that's going to be so important. And if we have questions, who can we call if we need to follow up? So I think that's just going to be so important. But that transition time is very, very difficult.
Throughout our conversation today, we've been talking about some of the challenges of living with FASD as an adult. So, lots of mention about the issues with maturity, issues with memory, executive functioning, independence, things like that. So for each of you, are there any strategies that you are using in your daily life to help with some of the challenges that come along with FASD?
I can tell you just, practically speaking, Alexa or an Echo has become part of our family. So I have one in every room of the house, including the bathroom, so that, yes, if I'm taking a shower and I all of a sudden remember, did I send that email? I can yell that to an Alexa or an Echo, right? So there's all sorts of things like that. And again, it's struggling to see what works. And I think that would be having a guide, again, come in to help with this and identify where are those strengths, where are those challenges during this transition time.
Yeah, I would wholeheartedly agree with Laura. We use Echo, Alexa devices quite a bit. We, schedules on cell phones, having everything written down to be able to refer back to it, because it's those memory pieces that are challenging. And then also having time and space to be able to unmask, because when you're at school, they're masking. When you're at work, you're masking, although hopefully not in certain workplaces. But really having the time and space to have that downtime.
So much good information, strategy, structure, the routine. And again, coming back to the idea of having space for yourself. Even if you are in a 100% accepting workplace for whatever your situation may be, sometimes, and again, I'm only going to speak personally, sometimes I'll still mask. I have a neurodivergence, and my employment, the people I work with, my colleagues, my students, they are incredible people. However, sometimes I still internally feel that need to put up a front and say, nope, everything is fine. Nope, I don't need anything additional today. Even if I do, even if everyone is wonderful. So the idea of having that space where you can truly be yourself, decompress, take a breath, exhale, whatever it is so important. What are some of the stigmas surrounding FASD? And most importantly, I think, how can we work together to reduce that stigma? Because in my view, and please, I'm so anxious to hear what the two of you think about this, I feel that still FASD is highly stigmatized, but I want to hear from the two of you, the experts on this.
I think when most people think of, if you close your eyes and you picture a person that has given birth to a person with FASD, we may picture a person with a substance use disorder or an alcohol use disorder. You don't picture somebody who looks and acts like me, and it could just as easily be me. And so that's why universal screening is so vitally important to dismantling stigma, because if we're having these conversations routinely, and clinicians can really help with this, having these conversations routinely with our clinicians about prenatal alcohol exposure, about substance use, about alcohol use in general, it will automatically help destigmatize it. It'll automatically de-silo where we're asking these questions. It's a great best practice for any physician, any clinician to use, is universal screening.
And please know that it is our pleasure to have the two of you on this podcast to talk about this very important topic. Before we go, would the two of you be able to give us some information about FASD United's Family Navigator program, and more importantly, how it can help family and others that are looking for FASD resources?
I love to talk about this because it's an amazing program. We offer, through our Family Navigator program, support for families and individuals who are navigating life with FASD. And it provides personalized, kind of a one-stop shop to connect families, people with FASD, and even professionals. We'll support professional questions as well, connecting them to services and supports that are tailored to meet what they need at that moment. Because FASD is consistently inconsistent. So what you need Monday might not be the same as what you need on Tuesday. Our family navigators are trained advocates like Laura, who understand this world. All of our navigators are either a parent caregiver of a person with an FASD or a person with an FASD themselves. They understand this, and they're able to connect to appropriate healthcare, educational support, community resources, and really work directly with the individuals who are reaching out to us to provide resources and information tailored to each situation. The other thing they do, I still remember the first time I spoke to another family that was like mine, that had kids with FASD. It was incredibly powerful. Mm-hmm. So our navigators serve as peer support and an emotional support system. Feeling heard and validated and supportive, and acknowledging the unique challenges of trying to navigate this world that isn't built for someone with an FASD. Practical support coupled with empathy, I think, really empowers families and helps build resilience, mm-hmm. Manages stress, creates a more supportive environment in general for the families, and just feeling like you're not alone. Imagine growing up as a person with an FASD, being the only person you know with an FASD. What a challenge, right? So providing those community connections, I think, are huge. And our navigators, they're available from 9 a.m. to 10 p.m. Monday through Friday. That's Eastern time, so they cover coast to coast. You can connect with them by phone, by email, through our website. It's really meant as a no barrier, no referral required, use this as many times as you want to, free service.
Excellent. And we will have information on how to connect with FASD United in our show notes. Laura, is there anything final you would like to leave our audience with before we go today?
Sure. So I think as mom to a young adult and as someone who's just recently diagnosed, I think I would like for, just generally speaking, for the public to think about and be more curious about it. Maybe asking, could this be FASD? Especially if you see their chronological age maybe not matching what you're seeing or what you would expect to be seeing. So when you see someone that's struggling with their age versus their abilities, I think it's worth considering. Could this be FASD?
Excellent. Again, thank you, Jenn and Laura, so much for sharing your knowledge, your expertise, your tips, and your lives with us and our podcast audience and the greater public. It is so important. It's not spoken about nearly enough, and we are happy to support information about FASD and the treatments that are available. Now is a great time to think back at our original question that we proposed at the beginning of the episode about how can we improve transitioning from pediatric care to care for older individuals with FASD. Test your knowledge now and earn some continuing education credits by clicking on the link in our show notes. That's going to do it for this episode of the Mother to Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847. By text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.